All right, I am Maria Kokas. Please call me Maria. I'm the Director of Learning Systems from Henry Ford Hospital. I have the pleasure of working with all 800 of our trainees. We have 48 residency programs. So the topic today on feedback is near and dear to my heart. Of the programs that I'm requested to develop and deliver at Henry Ford, both for trainees and for faculty, feedback is by far the topic that gets the most requests. So I do want to say that I have no disclosures. Okay, no disclosures. And before we get started on the program, though, I'd like a little information about all of you. If you could just raise your hands, and I'll try and get enough categories. How many of you work with students or residents, trainees, or learners of some kind? Okay. How many of you manage people or work with different groups of people? How many of you work with a colleague, have a spouse, children, or significant other, or friends? Okay. The information that I'm going to be covering today, especially the part that addresses feedback, is applicable to any part of our lives. And I have worked for years to distill this so it's applicable and generalizable across our lives. So I will be talking today from the context of the modules that Wayne State has purchased, has made accessible to us from Ohio State, that are called FD4ME, or Faculty Development for Medical Education. And at the same time, I want you to recognize that all the concepts that I'll be covering are applicable in classroom settings, in one-on-one settings when you're working with a small group, applicable if you are working with one of your children on how you can have them better accept feedback. And from my perspective, it's very important that we not only learn how to give better feedback, which is usually the content of most presentations, but from my perspective, it's very important that we build a common culture of feedback so that we learn not only to give better feedback, but also to receive and elicit better feedback. So today we're going to have 3 topics that are kind of intertwined, and we'll be here until 3:30. So the objectives for today are that by the end of the program, you'll have expanded your knowledge a little bit about effective feedback. You'll be able to, okay. Oh, okay, thank you. You'll be able to demonstrate one feedback method. You'll be working in small groups. And as far as instructional strategies go, I'd like to consolidate some instructional strategy information and present it to you in the context of flipped classrooms. We hear a lot about flipped classrooms, and there are a lot of misconceptions about it, and I'll try to debunk part of that and try and build it more into a mainstream way of looking at instruction. And when I say instruction, again, I'm using it very loosely. It doesn't have to be in a classroom. It may be a question of working with a colleague and helping that colleague better see how a process can be implemented. I have 3 kids. I wish I would have known some of this when I had kids, because I always hated it when I'd be telling them something and all of a sudden they'd be looking at the middle of my forehead. Does anybody have kids who do that? And by then I lost them. So I wish I would have had some of this information at that point, which would have been applicable. And please interrupt me at any point if you have any questions, because I would like to get your input into how this is applicable for you. I will be asking for volunteers at different points, and I hope you'll be comfortable enough to volunteer. Nothing's really difficult. It's mostly life experiences and how we can interweave all of that. And if anybody wants to move up closer to the front, that's fine. If not, that's all right. I'm glad we've got you all on one side of the room. Okay. So with that, we'll get started. This is in medical settings, and I could generalize it to say particularly in higher education, and it kind of goes through all the strata of our lives. Feedback, how to provide effective feedback and how to elicit and accept feedback. And this isn't just my opinion, this is documented in a lot of medical literature, is one of the most valuable and most misused and misunderstood tools in learning. And I have to admit, I have a bachelor's degree in education and a PhD in education. I never had a class in feedback. Somehow it was just rolled in with all the other concepts associated with learning, and the longer I work with professionals, the higher I get in the food chain of professional education, the more I see that it is absolutely valuable, absolutely misunderstood, and misused because we're not trained in how to work with feedback. And there are a lot of misconceptions in feedback, which I'll talk about a few of them, and some of them are also addressed in the module that I'll be addressing. I would like to start off by distributing these. You don't have to take the sheets that are at the end of the table. If you could just leave those upside down, please. I will distribute these, though. Oh, yeah, sure. Okay, you're all doing exactly what I thought you would do, which was what I had hoped. I'm going to be kind of turning some theories of instructional design upside down, which I have found are the most effective in working with, again, the learners who I work with are medical students, trainees, residents, fellows, and physicians. So they are highly trained people like you who have worked very hard to get where you are academically, and you want to get to the meat of the information right off the bat. Traditional instructional design takes us through, we identify our objectives, we give you an introduction, we take you through the body of the information, we cite the research, we take you through this very long process, and then we come to the end point, which would be possibly a tool, in this case, that you would be using for feedback. I have found that in a medical setting, in any setting in higher education, I lose people by the time I go through all of those steps. By the time I get to, I've gone through the research, I've cited the research, I talked to you about this, and by now you're thinking about, you wish you were home, you had things on your desk. If you're a physician, you have patients you want to see. How are you going to get your kids supper tonight because they're at soccer? I mean, I've lost you by the time we get there. So what I'm going to ask you to do is, if you drift today, which I would like to say I'm such a good speaker, nobody will drift, but it's not the case. If you drift away from what we're talking about, or what I'm talking about and you're listening to, drift to this, if you could, please. Look at this from the perspective, it's the green sheet that you have. I'd like you to look at that from the perspective of how could I use this in giving feedback to anyone? And you can think about anybody. It could be a child, it could be a spouse, it could be a colleague, it could be a student you work with, a trainee. So I'm sure somebody will drift, and I'll be perfectly happy to see you drifting to that rather than drifting to your iPad or your iPhone or just drifting off into space, okay? So this is a method that I've developed that I use regularly, so you have a place to go with your thoughts if I'm not riveting. So whenever you see this green, that means I'm going to be looking at that tool that I've given you. It is a feedback tool that looks very, very simple. It's actually very concise, and to use it, you have to develop very specific skills to be able to be concise giving feedback. And when I work with this tool, just if you want to use it at some point, I'd be happy to email it to you also. If I'm working with a group of faculty members only, people in positions that are generally giving feedback, or if the perspective is giving feedback that day, then we work with one side of the handout. So this is my feedback for you on these points. If I am working in a department and I have the tremendous privilege of working with both the faculty and the trainees, then my ideal is to be able to change the culture or work with the whole culture of feedback. So at that point, when I'm working with the faculty members, I'm working with this side of the equation of best ways to give effective feedback. When I'm working with the trainees, then how should I request better feedback? And in those cases, I split the information apart. For purposes of today's presentation, I've put them together, but the constructs that underlie this are the same for everyone. It's very important that we focus on the observations and what can be learned from the feedback, both from the perspective of the giver and the receiver. It's also important to look at how does it sound when I say it? Because whether we like it or not, feedback ends up being a pretty personal, sometimes very emotional topic for a lot of individuals. So when you drift, if you could just drift to this, that would be great. So I would like to, before we go into the actual topic of feedback, I'd like to go through some just little bits of information on research that's been done for best college teachers. And there's a book that I'll cite at the end of the program that's, if you're interested, no matter where you are in the spectrum of instructing individuals, I thought it was a very, very fine book, easy to read, and consolidated a lot of information that I think about. I don't know if everybody else does. But the best teachers, and I'm using this broadly, are people who emphasize the pursuit of answers to important questions. And they encourage their learners to use methodologies, assumptions, and concepts from a variety of fields to solve very complex problems. That's in contrast with what we end up seeing a lot of times, which has been coined as bulimic education. Who knows what bulimia is? Can somebody tell me what bulimia is? You just raised your hand and put it down. This gentleman right here. Just broadly, what is bulimia? What is what would you read about it if you were reading in People magazine? What's bulimia? I don't need a medical term. Okay, so the term bulimic education, which I thought was brilliant when I came across it, is we gorge our students with facts and facts and more facts and more facts so they can collect those, give the right answer on the test, purge all those, and make room for more facts to come in, all right? So to be a best in class for anyone who's working with instruction, you try and stay more in the first paradigm of helping your learners to answer big questions and to solve problems rather than just collect all that information and then spit it out and get more. So we are looking for the possibilities of, I'm looking for the possibilities of helping you see how you can build more of that, the best practices of emphasizing the pursuit of answering questions rather than just gorging ourselves with a lot of information. So our hope is that we will inspire and emphasize that problem solving, and then the big fear is that a lot of our educational environments, because a lot of what we are finding from elementary school all the way through is we are teaching to the test rather than teaching to the knowledge. Another thing that categories that best teachers know and what makes them the best is they know that knowledge is constructed and it's not received. And a particular favorite quote of mine is by Josh Billings, and I always get it wrong if I don't read it. The trouble with people is not that they don't know, but that they know so much about what ain't so. Okay? Once again, the trouble with people is not that they don't know, but that they know so much that ain't so. As we have learners pulling information from so many different perspectives, that is becoming, I think, more of a challenge than it ever was before for educators. So a highly effective instructor would know that we construct knowledge rather than just collect information. Can anybody give me an example of how you might construct knowledge rather than just collect facts? Sure. It can be anything. It doesn't have to be in an academic setting. You can talk about a 2-year-old, how they learn to speak. What was an example you come up with of, I am constructing knowledge rather than just collecting facts? All right.
Baking. First trying to make your first grilled cheese sandwich. You could explain it, but experimenting with the temperature, the amount of margarine or butter, and this is a way that you construct knowledge about temperature and browning and things along those lines.
Okay. Who can take that into some kind of an academic? Yes.
I think If you assume that what is being received or what is being given to you are facts and data and elements of knowledge,
Right,
then you really have to construct the knowledge yourself by, there are so many dimensions to it,
yes,
contextual,
right,
interrelated, what comes first, what comes next. Then first is the broad picture, then going down, all these types of relationships and where you start, conceptualize, and then in your own mind, you need to construct solutions for questions that can come off that body of content. Do that, you have learned it.
right.
Otherwise, if you don't do that, you haven't learned. So the giver or the receiver of facts, I don't think we have time or the medium, even with if this these dimensions adequately covered in the time period. You need to do the rest of the stuff yourself, contextual meanings, comprehensions.
Yes.
These are
This is a whole area that I'm fascinated with how we are, and I could do another whole workshop on how we collect factoids, and we don't have the same kind of constructs that we used to have when we were learning from a single source. Not that the single source learning we had before was always the best, and I'll give you some examples of what has changed that's very good, but it's very hard to take all the information and assimilate it now. But if you're a very, very good instructor, very good teacher, then you understand that that construction has to somehow take place. You had something. I could just.
I was just going to say, in terms of, in medical education, oftentimes we'll give illness scripts. And somebody can learn what the common presentation of a disease may or may not be, but it's not until they apply it to every individual patient and notice the subtleties of why this script does or does not impact or apply to this patient. That's where they construct that knowledge, as opposed to just memorizing, these are the common symptoms, XXX.
I was a particularly good example of that when I had my first daughter because I had read everything about babies. I read everything. I had never been around a baby. I had it down pat. I knew what every book said. They handed that baby to me and I was terrified because she moved and cried, and I didn't even unwrap her in the hospital because I was so afraid of her. So yes, you need to take that information and be able to construct something for yourself. So when we're looking at, particularly in higher education, it's very important to not assume that the trainees or the learners, whoever they are, have constructed that. They also know that mental models are very, very hard to change within ourselves. There have been some fascinating studies done on learners who have gone through all kinds of educational processes. They have the knowledge, but they don't change their behaviors. I mean, we can see that in very common settings. There's all kinds of literature out that shows that smoking is bad for your health. I can read it, I can get handouts about it, my kids can tell me about it, but if I'm still smoking, I'm still smoking. Can anybody give me an example in your setting where it's very hard to get your learners to change a mental model? Okay, again.
In the patient safety model, we all know that we have to clean our hands before we enter the room and after we leave the room, and we still observe students, residents, and practitioners, healthcare providers who don't do that.
Okay, that's a great example. At Henry Ford, we've had huge campaigns when the focus is on hand washing, then our numbers get so much better. As soon as we take the eye off the ball, then the numbers start drifting, and I'm sure we're not the only ones. And that just seems like something that's so simple, but that is a mental model of the individual thinking, my hands are probably not so dirty, yours are. Another thing that these very, very good instructors understand is that questions are crucial. It's really easy, it's very easy to keep not asking good questions. It's very easy to answer questions for learners instead of having them think for themselves. One of the biggest challenges I have with our faculty is when I work with them is when a trainee says to them, how am I doing? But the faculty member says how they think the trainee is doing, rather than asking the trainee, how do you think you're doing? What did you do well today? What did you do well today? In anything. Okay, that's a starting point, and from there I could continue asking questions. I could find out a tremendous amount about you. You would also find out a tremendous amount about yourself. We have whole workshops on, again, on how to ask questions. Lots of times we heard the terminology of open-ended questions, and that's kind of a nebulous term. For anyone in this room, what would that mean to you if I said ask open-ended questions? You just look at me and nod your head? Okay, an open-ended question is one that starts with what, why, or how primarily, that you can't answer with yes or no. These very fine instructors also understand that caring is crucial. You can tell me all day long that you need me to learn about something. If I don't care about it, then it's not going to be important to me. So I did want to go through those points just a little bit so you could kind of see why we're going to the next part of what brings us here today. We are here today because Wayne State has made the modules from Ohio State available to not only to Wayne State faculty and affiliates, but organizations that are affiliated with Wayne State. FD4ME stands for Faculty Development for Medical Education. These modules are developed, most of them have been developed by Ohio State faculty, and many of them are applicable to all of us in working in medical education. I went through a number of them. Most of them are very good for background information. Some of them refer to Ohio State's curriculum, which you just have to ignore, but the content is very good. So what I want to do today is go through how you can use these modules to more effectively work with your faculty development training. We really all have to share resources. I don't know about here, but at Henry Ford we don't have that many resources, so I try to find anything that's already available. And these have a lot of topics that are relevant for us. Some of the topics, just to go through the laundry list of them, are teaching in various medical settings, professionalism, dealing with difficult learners, facilitating small group instruction, how to operate and conduct team-based learning sessions, physician well-being, promoting reflective practice in medicine, dealing with emotionally charged situations, mentorship, and today we're going to be working with the feedback and evaluation in clinical settings, in clinical teaching, excuse me. Many of these have really, really good content. The subject matter experts, I think, seem to be vetted pretty well for the modules that I looked at. But again, these are for content. I'm going to be looking at how we take that content in the context of a flipped classroom or a flipped learning setting, so you can use that content for practice so we can start changing behaviors in your own settings. So before we go on, for those of you who, and I'm among some of you, I sometimes think that, you know, things are changing too fast and I haven't changed enough to keep up with all of it. And I would like to go through, I'm going to go through just two paradigms with you. The one is with travel and how, without really realizing it, the way we travel has changed so radically. Who in here can remember ever calling a travel agent? Am I the only one who's old enough to call a travel agent? Okay. Some of us have called travel agents, okay. For those of you who are not at that point in your lives, travel agencies used to be the only way you could book flights, the only way you could book travel. You'd have to go to a travel agent. That person would then check through all of their documentation and find out how you could travel. They'd book your flights. They would help you with, it was a really quite a, I thought it was kind of a nice process until travel agents became less skilled. So then we went from travel agencies to travel guides. These kind of overlapped. And now we started migrating from calling the travel agent to buying our own travel books, doing our own travel planning. And that kind of migrating. And then we took this huge jump from guides to how we now travel with the internet, which one of my daughters has told me about Rome to Rio, which is so cool. It will tell you everything from which train you should take, or should you take a train, a bus, a plane, how much it costs, what the schedules are. I mean, it's awesome. So now we have gone from getting information where we had to depend on someone who had to depend on printed guidebooks that may have been out of date, to maybe calling somebody, to who knows how they got their information, to travel guides that started out being printed, and then the travel guides are now on the internet. Now we can just go right to the source. So that paradigm has shifted pretty radically for us, and you know, even if you went into it kicking and screaming, you probably are seeing that maybe you've made the shift. Now I hope I don't offend anybody, but in medical education, lots of times educating individuals is something more like, just do this. Read more, do this, take care of this, and you'll get better. That's not working anymore. I don't know that it ever worked particularly well before. A couple of you are smiling. I do a whole workshop on just read more, because it doesn't tell me anything. So anyway, we go from that to looking at maybe, excuse me. If we have new tools, then maybe we need new methods too. I mean, in addition to going from travel agents to guidebooks to something like Rome to Rio, we also have gone from globes to kind of figure out where you're going, looking down the road and looking at a map, to now we have our GPS. How many of you really didn't want to use a GPS when it came out? I just thought, this is just not for me. I love my GPS now. So if we're getting information differently, and our paradigms are shifting with the sources of information, how is it that when we're in educational settings that we're still in some of the older paradigms that are somewhat in conflict with how people are living and getting information? And I give you these examples because a lot of times when I'm speaking with particularly senior faculty members, their contention is that they don't need to change, it's the new learners. I don't think it's so much that we are new learners. I think it's more that we have information coming to us from different directions. So people still learn the same way. We have to still work in those constructs of those best instructors, that we have to construct knowledge, we have to be able to ask questions, we have to build structures. But the way we're getting the information is coming to us differently. So my contention is that as educators, we need to kind of look at how we build our instruction and use more of a GPS perspective of building our instruction rather than a globe. Okay? When we are working with a GPS, we can get exactly where we want to be. Who has their GPS? Who's got, somebody's got your, okay, David, you've got your, okay, all right, now David, I'm going to ask you to find 10 Main Street. That's the only address I give you, 10 Main Street. So how many hits do you get? 10 Main Street? No zip code, no state, no city.
Probably about 10.
Probably about 10, okay. That doesn't quite get you where you're going because you're not being, 11, you're not specific enough. So if I was going to a map and I said I want to go here, or to a globe, not very specific. If I go to a GPS and if I leave out the city and the state, I get quite a few hits. Now put in 10 Main Street, pick any city, but no state. You'll probably just get one hit then. Okay, all right. If you had put in some city like, I don't know, Springfield, you probably would have gotten another 10 hits. The point is, with a GPS approach to education is, if we put our very specific endpoint in mind first, very specifically, what do we want that learner to come away with? Okay, about 10 for Springfield. If you would have, though, put in 10 Main Street Detroit or 10 Main Street Plymouth, you would have gotten probably 1. With the GPS approach, which is very different than the older way we used to plan education, where we could kind of drift around a little bit more. With the GPS approach, you can, I'll stand in one place. Stand right here. If when you're building your instruction, even if you're talking about doing a little something with a colleague or with a friend, if you look at exactly where you want to be and then back into that, you will get to exactly what you want for the instruction. If I want the behavior to be that I want the individual to, what's something you need for your medical students to do? What's something very specific that you want them to do? Okay, do a good neurological examination. Okay, that's the end point. Then you back out from there. What are all the things they have to do to get there? That builds your objectives and your evaluation before you ever start plugging in the content. It's not different education, it's a different approach to how, I believe, how we build and construct that knowledge. So if we keep going and we look at, do we actually have a paradigm shift in what's taken place? Okay, I kept thinking probably, I'm kind of not shifting as fast as I could, but I was thinking the other day, I was cleaning out some books and I've got the big old Oxford English Dictionary. I haven't used it in probably years, and that used to be one of my best friends. We've gotten away from things, we've migrated away from paradigms. I'm sure there are some Gray's Anatomy textbooks around, but a lot of our learners are not going to the textbook any longer. We don't have the luxury of going through all the chapters to come to the conclusion, and a lot of the learning is taking place in situations like YouTube. So the question then for us as educators is, how do we take that information, cluster it, build it so it's appropriate for the learner? Modules like the FD4ME start that process for us. I would like to, so we can see how this has affected some of you, I would like to break you up into small groups. And I would like you to, we can probably have 4 groups. Just cluster around each other. I'd like you to discuss among yourselves what are some of the benefits and what are some of the challenges associated with going from the paradigm of having the single source knowledge and all the knowledge coming into us from a lot of different sources. If you could work in small groups for a few minutes, I'd like you to be ready to share that with us, because these are challenges that are being faced in every educational setting. So you're going to work in your small groups. What are some of the challenges and benefits of going from the single source of knowledge acquisition to getting information from all different places up to and including YouTube? There are a lot of interesting conversations going on in the room. Who would like to share some of the things you came up with?
I think the easiest one and the most common would be the credibility of the particular source that's going to be accessed via YouTube and things like that.
The credibility is always great. The credibility is questionable. What's easy about that?
There's so much information, and anybody who has computer to or access to a computer and the internet could post information or their opinion about whatever topic exists. The other thing was that the amount of data is immense, and it can be swimming through like an ocean, and a lot of it is conflicting information. So you'll have both viewpoints, 2 studies looking at a particular thing, each of which has an opposing conclusion and things like that, which can be confusing to learners. Things like Gray's Anatomy and other classic textbooks go through additions and revisions and additions and revisions to improve kind of the linear flow and interrelatedness of what is being presented. And you only get 30-second or 2-minute truncated versions, and it's hard for learners to kind of connect in terms of the interrelatedness of the entire system looking at 30 seconds of knowledge. And then the last is something that you mentioned earlier, the drifting, the practical aspect of rounding or trying to teach people who are doing this. and having an idea of whether they're texting, emailing, or trying to cite some information.
Or trying to figure something out. This is a big problem because they may be bona fide trying to figure something out. I would like to comment on the, the revisions of the textbooks. And although I always thought that that was probably such a, perfect system. I mean, I just grew up thinking, I was that kind of a learner who thought if it was in the textbook, that's where. Well, it takes, sometimes I work with a medical publisher right now, sometimes it takes them 3 years to get a book out. The way research is taking place in some fields, by the time they start that book, work with all the editors, all the work, 3 years, it's obsolete by the time even the book gets out. So then there's a question of who do we trust? So that's a huge, huge challenge that we are facing. And I mean, if you go back to, the old philosophers, I'm sure when, one philosopher started out, he was the best game in town, then, Socrates came along and blew his theory. So it's really hard to know, and everything is happening very quickly in our YouTube world right now. So that the credibility and the access are huge problems, challenges. I don't know if they're problems, they are challenges. Another group. And if you had the same thing, but you had a different spin on it, I would really like to hear that, because this is we could have a whole, probably a week workshop on just this little segment.
Well, I'll give some benefits.
Dr.
Oh,
Brennan.
hello, Dr. Simone Brennan, yes. Feels strange to say. So some of the benefits of accessing what we can through YouTube and other online things is that you have quicker access to what you're looking for. You get multiple perspectives. So in other words, one of the benefits I was talking about with sources like Gray's Anatomy is that it's a standardized way of looking at something, so you have sort of the shared language and you have common understandings about what to call things and how to move forward. But that can also be a challenge because it can limit you, and so online you have many more perspectives and it's more dynamic that way. And also we talked about, in terms of adult learners, that when you have access to things online, you can watch videos that show you how to do something. Even we were discussing the New England Journal videos that are very popular because they help you walk through the process. You can be a passive learner, you can just read, or you can look for visual cues. And also patients are using this stuff.
Absolutely.
And so you have to know what they're using. So I'm going to focus more on the benefits. We talked about lots of other things too, but those are just a few things to.
And pretty much everything that we're going to find, the benefit is also the challenge. It's always a double edge that we're looking at, which is much more complicated as an educator than when I started out teaching years ago. I mean, it was just kind of what I had, which to present was what was there. It's just a whole different world now, which is very exciting, and at the same time creates a situation for anyone who's in an educational setting to really have to step up to how we're looking at information, how we're looking at constructing knowledge, how we're looking at paradigms that individuals live in as they're collecting information. Another group. Thank you, Linda.
Hi, I'm Odalis Abreu from Infectious Diseases at Henry Ford. So a few things that we looked at were, I think we talked about benefits and also detriments from few things, but I think if we need to summarize it, few things are time. So time, not only that we are constrained by time, but how can we develop things through time. So you have a finite number of minutes that you have to see a patient, to discuss a case. So that's good and bad because you can become efficient, but also you can sacrifice a few of the things about what you are going to discuss. The instant gratification, so I need to know now, and what I might look tomorrow might be different than what I looked at today. So that's one thing. Different styles, so with rounding, so it might be that I have a rotation of 2 weeks. So I come today and I do things differently than my previous colleague. So people get the opportunity to see different styles and maybe choose what's right for their knowledge, as well as looking at what they might take out of that specific experience. A few other things are different stages of learning. So trying to, groups are usually very diverse. So some of them might be very tech savvy and others might not. They might know the concept that you're trying to tell you, so try to address from the background up to maybe your medical student to your fellow. So usually try to find that ground. And constant changes. So what might be true today, we might need to use a different electronic medical record today, and we might need to use tomorrow. So that enhances things. Then two important things that I think we also discussed was a snapshot versus seeing the whole video. So trying just to say, this is what I see now versus seeing the progression of a condition or a particular scenario. So that's also important. So it's all kind of at the same thing with time, and also the gratification that you get seeing something immediately.
Thank you. Time, you know, in a medical environment, just seems to be our biggest challenge with everything. Everything. Thank you. And another group?
Neely from Division of Gen Med. We had a genetics person in our group, so their thing is constantly changing by the day. Every disease is associated with a genetic
Yeah,
predisposition.
you can look at the room and then
Oh.
look at them. I'll come over here.
Every disease has a genetic predisposition these days. You just have to find it. But our thing was single source is still a holy grail when it comes to anatomy, Gray's Anatomy. Any YouTube thing will refer to Gray's Anatomy with regards to the structure of the eyeball or the heart or how many bones in the body. But the sources, the multiple sources like YouTube, I think I agree with Jared, you know, the credibility is what we came up with, how current they are when it comes to teaching the students. But we think they are easily adaptable, portable, rather than carrying a big book. Again, 2-minute video is more catchy than reading through 200 pages in a book. But I think the single source still stays good in some situations and some fields.
In
And
some situations.
In some situations, and we have to encourage our students to go back to that
Yeah.
book, not saying that that's a substitute for that book. As a teacher, I feel that.
Okay, thank you. Is that all the groups? Yes.
These controversies exist and they will be exponentially problematic with the new media because everybody is contributing in different formats and so on and so forth. Can you construct a Gray's Anatomy on YouTube, for example?
Well, I have an example I'm going to show you. It's not
Yeah.
exactly Gray's
So
Anatomy,
when
but
you
it's
do that, you actually meet the requirements because this type of knowledge, the anatomic knowledge, you know, most of it is standardized, but there are areas even in anatomy like molecular biology and others, if introduced, they need to be incorporated. That's
Right.
again a book, you know, or that's a book of content. Construct this in different media. This medium should be converted to this medium.
Well, thank you, because I will be moving toward that. There are some sources, I just have a few of them that I'll be citing for you, that are really excellent. I think ultimately maybe if we could get to a vetting process of which are the most credible, that would certainly be helpful in medical education, because right now it's pretty loose on who is the most credible for the modules. But there are, the one I'm going to show you is Khan Academy. It's K-A-H-N. I don't know if you're familiar with it. Khan Academy has really branched out into medicine, and what they're doing I think is fascinating. I wish I would have had it years ago when I was doing my master's degree with all my biochemistry classes. I probably would have done better than the C's that I got. Maybe, maybe not. But that you're absolutely right that if we can take some of the traditional learning, maybe migrate it into this kind of a setting, maybe that will help more with the learners who are with any learners. I refuse to separate generations by types of learners. I think that's I think it gives us a way to excuse ourselves for not being good instructors. So I'd like you to, I'm going to have you go back into these groups twice more. The next time, I'd like you to go back together with, you've identified what are the challenges and the benefits. What are some things that you have seen in your environment that work in addressing these challenges? What are some things that have changed if you look at educational settings today compared with educational settings maybe 15 or 20 years ago, when you were a student or if you were a faculty member at that point? What has changed that is really addressing this that's working well? So if you could come back together, I'll give you about 5 minutes, maybe 7 if there are lots of conversations. What's changed that you're not seeing just lectures anymore? What's different that's working, that's resonating with you, that's resonating with your learners? Okay, could you share what you found that's worked with any of this? What's different than it used to be in instructional settings? Jennifer.
Hi, I'm Jen Turpin with the PRB with School of Medicine. Some of the things that we talked about was with a boss-employee relationship. Before, it was more of a higher level and the employee was at a lower level, which in a sense it still is that way, but there's much more of an open communication where you can brainstorm ideas. If there's a conflict within a work group, you can get together and say, okay, this is a solution or this is a possible solution. So brainstorming ideas, not being afraid to share what feelings that you have, maybe against a coworker, where in the past there could have been some repercussions for doing that. One of the items was that she went to medical school in China and you had to follow the standards, and there was no independent thinking. You could not think outside of the box. This was your school, this is what you had to do, where nowadays there's a little bit more thinking outside the box when it comes to other classes and other programs that you might be studying. And physical contact, for example, like you mentioned in this meeting, we don't necessarily even have to be here. It could have been Skyped, it's being recorded. So those are things that are better with time. The physical contact within this setting is ideal. But if there is an event where someone wants to see this presentation or whatever the case is, we have these other options available.
Thank you.
Jared Weinberger, Wayne State, and DMC. A few of the things that we talked about kind of mirrored what Dr. Raju was saying before, was to have specific apps for sources that we trust.
Yes.
That, listen, I have Stanford's Guide to Antimicrobials on my phone. That's a trusted source, and it's searchable, and it's an app. And both parties feel comfortable referencing and using these specific sources. The fact that they're using a lot of these texts and making them searchable and providing small caveats of summaries and recommendations makes it easier as opposed to trying to absorb an entire chapter dedicated to pneumococcal pneumonia.
That you may
and
not
things like
use
that.
again for another 8 months.
Right. And the other thing that I have found useful on rounds is sometimes actually asking or designating a couple people while people are presenting or we're discussing to actually look up a problem and get back to the team and answer.
Good. And
it's not too much of a distraction when you assign a couple people, as long as you don't interrupt the person who's presenting and doing that.
I think as educators, you need to really compile a limited source of standard material,
A foundation.
Follow it through in the whichever encounter that you have with the trainee or student, and then it's not only you. Jared should agree with me that these 10 sources are reasonable as the first step, Diane should agree that that's what it is. If the system adopts a general approach like this, the sources of limited sources, to give the first answer, okay?
Yes.
There are some detailed answers and complex answers and others where probably you need to access information from different societies.
Because you're answering a lot of big questions, conceptual questions.
Stuff, yeah.
Right.
that you can get. But you need to agree to a compilation of sources first, and then see that everybody generally agrees with it and follows through. Otherwise, the students and the residents and other, they access material from so many types of sources. Sometimes they have one or two answers that I don't even know.
Dr. Oz.
Yeah, they put it in the front, and then I look and so and
Thank
so.
you,
Yeah.
thank you, yes. Okay, another group.
I'm Chi Chung from the School of Medicine. So for kind of what we do here at the school, we've kind of migrated some of the physical diagnosis textbook into videos where we're demonstrating it on a live person and videotaping it and giving students access to that. One thing also for students on clerkships, you get them in a month or 2 months. You can't, a student isn't really always exposed to everything that they need to know for that for that specific specialty. And so having supplements, again, being able to see a specific gait, let's say in neurology, and they weren't able to see that in person, again, having a supplemental source that can kind of give that exposure if they're not able to see that within that clerkship month.
The beauty of using those supplemental sources also is if I'm in a classroom setting and I see it, I don't quite get it, then I'm stuck. If I have the supplemental source, I can go back to it. I was just talking with one of the plastic surgeons, and they had a trainee who was having difficulty with tying some of the knots. And he did phenomenally well after a very short time, and they asked him, he had found somewhere on the internet, he had found a source that took him through step by step, and it was a crazy number of hours that he had practiced at home because he had to develop that dexterity, but he got very good, and he attributed it to what he found on the internet, which was really fascinating because I had just had a conversation with the plastic surgery group of they have so much difficulty identifying if they can have trainees who have the right hands. How do you assess for those hands? It was fascinating listening to them. He had gotten better so much more quickly, and they were pretty fascinated, and that was what he had done. So having those resources available to go back to is very beneficial. Yes, there's, all right, go ahead.
So we talked about the concept of using some of these technologies, whether it's YouTube or even just a really well-placed journal article, to provide that background information. And so I did a lecture where I knew I didn't have enough time to explain all the background information about it, and I really wanted to spend the class time talking more about the clinical application. And so using YouTube and directing them towards the appropriate resources that you have vetted, I think just can enhance things and make it so that you can maximize the time that you have in person with that person. We started talking a little bit about utilizing that in the clinical setting as well. So this concept of providing background information that you expect the students to review. We think the challenge of that, of course, is how do you know that the student is reviewing that? But I guess that's always been a problem, whether you're assigning a chapter or a YouTube video. Do you have any assurance that they're going to watch it or review it?
And we're going to, we'll have the other group that's a segue into the next thing we're going to talk about. Thank you.
Old. I have an advantage here, and so I shared with the group how challenging it was in the past using things like Index Medicus, where you had to physically go to a library. Libraries were places, they were bigger then, and where they had lots of resources, and you had to hand look at things and request a lit search from your librarian, which took a week to come back. So that was physically challenging and challenging in terms of time. But also back then, there wasn't a culture that looked at the learner and encouraged and provided a way for the learner to learn how to ask and answer questions. And I think one of the things that all of this information has allowed us to do is help our learners learn how to learn. And so now we have, how do you form a question? How do you compare and contrast treatment or testing? And then we say, go to the literature here, look at this resource, and you can do that. And I think that culturally, we're very different than we were 30 years ago. And we have lots of different resources that then enable different kinds of learners to get the information quickly. And the other thing I just want to point out, because I have the microphone, is a classic New England Journal article that I remember reading in 1982 while I was drinking a cup of coffee outside of the ICU at Receiving Hospital that said coffee caused pancreatic cancer. And I went, ah! And that article was recanted a couple of years later, all the letters to the editor, and the article was not well done. But that wasn't publicized, and most people didn't read that. And one of the things about the different varieties of information now is how timely they are, and how when things change, they're changed quickly, as you mentioned, the contrast between a textbook. So some of this push literature where you get a journal update or Medscape allows us to be much more current and our learners to really teach us what's going on.
Okay. These are all very viable. They are things that have kind of migrated into the learning place. Some of them kind of imperceptibly have showed up. And I know we're using apps a lot. That 5 years ago, there were no apps in medical education, I don't think. I mean, maybe there are a couple, but they weren't very good. So things are migrating. So as you're all talking, you're talking about what you're doing now, and what I'd like to go into is this concept of a flipped classroom, which is a very cool name. Sounds very new and very extraordinary. A lot of you are already flipping your classrooms, particularly with what you're describing. What's your concept of a flipped classroom? Somebody who's heard of it? Maybe your kids have a flipped classroom at school, maybe. Has anybody heard of a flipped classroom, what you think of it? Yes.
So it's where you provide the traditional lecture in a video or some other format where the learner can do that at their own leisure at home, and then the class time is spent for more discussion and critical thinking of that particular, the application of whatever that knowledge is. It's kind of how I think of it.
That's exactly right. And a lot of people have been doing that for years. It just didn't have a name. The purpose of a flipped classroom, ideally, is that the learners would have more of an opportunity to create those mental models, do more problem solving, do more thinking and more talking, and have the instructor be more of a guide. And if you go back historically through very, very good instructors, a lot of them were doing that anyway. We just didn't call it that. We used to call it homework. And then you would have discussions in class. That's what it used to be called. So now this is this great name that's a flipped classroom. There's a tremendous amount of research being done around it, and quite frankly, the verdict is still out on where the flipped classroom concept is appropriate in its purest sense. In its purest sense, this is kind of a little graphic of the, in the purest sense, as you said, there used to be a lecture where the instructor was doing all the talking and the students sat quietly, more passively listening in class, and they did their homework and then they came back. In the flipped classroom, we are essentially providing the homework ahead of time so that I, the learner, will get the background and I can come in ready to discuss the topics, which in an ideal world is tremendous because it helps me build those mental models, it helps me construct the foundations, it helps me synthesize information, pulls it together for me because the time that the instructor and the students are spending together or the learners are spending together is spent for that synthesis of information. The huge challenge is, how do we know that they, even if it was a really cool video, how do we know that they watched it last night? How do we know that they're not walking down the hall, running into you, watching it on the way in, and weren't really synthesizing the information, which I've had that happen. A resident was on his way to the program I was running, and he bumped into me, and he just fell out of his mouth. He said, "Oh, Maria, I was just reading what you just sent me." Well, that's not exactly what we want to be happening. So the concept is a very good idea. It seems like, and this is just in the, I haven't researched it in depth, it seems like a flipped classroom setting is better when there are small groups of learners and they're already invested in the topic. rather than trying to have a lecture hall of 200 students or 200 learners and have them assume they've all watched, read, whatever it was that you had to do, and they're all ready to come in for a big discussion. So it seems to me, and this is just my opinion, it seems like the flipped classroom concept in its purest sense is more effective when the learners and the instructor already have a vested interest in everybody learning and they all care. If we go back to those first slides that I had, you already care, you're already interested in constructing mental models. Possibly you already have a mental model that you know is not working and you care about it so much that you want to change it. Those topics, those settings that allow you to have more interaction in a small group. So I was asked by the MCME committee who was working with the FD4ME models to really look at flipped classrooms. You're already doing a lot of this. And I would caution, like with anything, you know, when anyone says we should do everything online, you know, all learning should be online. Well, it doesn't all, nothing, there's no silver bullet that's going to cause everything to work properly. I would say in some settings, particularly if you have material that lends itself to content that needs to be discussed, then it works very well to have that in a flipped setting. And if you have that kind of a dynamic that it's a smaller group and the learners are more invested in those small group discussions and interested in problem solving. Those settings are very appropriate for the flipped setting. So given that, because I know all of you are just so interested in feedback, which is one of my favorite topics, I'm going to give you an opportunity as a group to put together a flipped classroom module. Okay? And we're going to assume that, and I would like you to move into maybe 5 people per group so we don't have as many groups. And I will have you out of here by 3:30. What you have at the end of your table is a guide that we developed specifically for the FD4ME modules. I'm under this again. These guides are usable for pretty much any module that you want to take information from and build into a teaching setting. We built this so you could use it using the information from the module and go through this as a guide. This is a generic guide of how you would build small group instruction. The information that you've already read, you read this last night. You were the good learners, okay, but I'm giving you a cheat sheet, okay, is a little bit about feedback and then this tool that you're going to use for your learners. So those are the things you will be able to work with in your group. So your task is I'll come back to these. Oh, I just missed a really good, okay. Okay, your task is to build a program around the materials, make sure that your participants in the group will be working in small groups, have a way to check them for understanding, give them a chance to practice, and you have to figure out how you would assess their learning, and then I want you to demonstrate for the rest of us how your learners would go through this. So you don't have much time today. You have a class that you're going to be teaching in 2 hours on feedback, and you've got a flipped classroom. Your learners were supposed to have read this information last night. How would you construct this so your learners would be doing more talking than you were doing in that session? Got some puzzled looks. Does anybody want clarification? Okay. So this is real-time development because you don't have a lot of time to build because you're a busy instructor. Yes? You're building it together and you're going to demonstrate how a learner would actually go through that module. Who would like to talk for each group? You can either talk about it or demonstrate it, whatever your group has decided to do.
We'll just discuss it.
If you could frame what you had talked about. And look at the group so you don't have your back to anybody.
Okay, so the module we came up with, so we decided to focus on how to teach preceptors or, attendings or whoever, how to give effective feedback
Yay.
in a clinical setting. And so we decided that probably before, if we have before whatever meeting we're so we're going to set up some kind of a meeting, but before that, we want to provide them with videos of 3 different feedback sessions. So we came up with, the 3 examples were an attending having to discuss an issue of professionalism, of coming late, and giving feedback about professionalism and how that went. And the second one was, you're not washing your hands, and, giving feedback about that. The third one was something to do with HPV vaccinations, but now I don't remember what it was. Oh, vaccination. Oh, okay, that the learner did counseling and getting feedback about how that counseling went. And then just without teaching them any framework at that point, have them come back with what they thought went well, what they thought didn't go well. And then of course, facilitating that conversation. After that, in the classroom setting, presenting the framework of this that you've provided here, keep doing, start doing, stop doing, presenting that framework in a formal setting, giving examples, and then in the context of the class, going back and watching those same 3 videos and having the learner then apply that concept and that framework to those videos and see if they would change their opinions about what the feedback they're seeing, and then coming back and discussing that again. And that's all we came up with so far.
That's quite a lot for that. You just had 20 minutes. No, that's tremendous. I would like the other group to share also, and then we'll come back and not compare, because you'll have come up with very different things that you'll work with. But yes, this group.
So ours was, a little bit different. Certainly, similar, pre-work that the students would be given. But our concept was, when they got to the classroom, was to actually immediately split them up into one-on-one sessions.
Oh, interesting.
One person would have to give feedback, the other person would have to receive feedback. We thought about maybe recording it to see, from from an outside perspective, but certainly, depending on the size, it'd be difficult to do.
We're working in an ideal world right now.
But then, and then, after that, they would reflect back on the experience, and how did you feel about again, being the person who gave feedback and whoever received it, and then again we would go through kind of presenting these tools, explaining to them what feedback is, what feedback is not, maybe even discussing any past experiences, so everyone could kind of have a discussion about what they've all experienced before, and then at the end we could have them flip and then kind of do the exercise again. So.
Great for both groups.
Yeah. Well, they don't necessarily have to. Because when they come and they have to do it one-on-one, then do this. About presenting tools is questions to ask, and this kind of process. Yeah.
My dream is that everybody at Henry Ford will walk around with those green sheets in their pockets. I pass out hundreds of them in programs that we run. I tried to get that, but I couldn't get another badge buddy. I tried. I hope you see how both groups have taken you had the same information, and you have treated it so very, very differently. Both groups came up with what looked like very sound approaches to having the learners become involved, to having the learners engage. The instructors are doing very little talking here. The key, I believe, is to make sure that you don't try and cram so much information in that we don't know what we're supposed to be learning. There's really not a lot of content here, but if this is very important, and if your goal at the end is, you know, if you use that GPS approach, if your destination is that you want them to see how it feels to give and receive feedback, if that's your goal, that's where your GPS is pointing, then you have done a very good job in having them have to give as well as receive feedback. I find it fascinating how many groups I work with that, you know, if I'm working with the trainees, I always separate the trainees and the faculty initially. And then if my ideal is I have faculty for 2 sessions, trainees for 2 sessions, and then I bring them together for grand rounds to show them what we found. It's fascinating to me how easy it is for me to say, well, I'm the trainee, well, the faculty need to learn this. I don't need to learn this. And the faculty say, well, the trainees need to learn this. It's every time I get that kind of a dichotomy. And then when I put everybody together in the room, when we have focused those sessions on my personal responsibility in this process, we are seeing some changes in a couple of the departments in the whole culture of feedback, which I find very exciting. What you have done was a very different approach. You took the same information, you treated it differently, and again, the common thread here that I see is your learners were doing a lot of the talking, your learners were practicing. It's more comfortable and easier for us in an instructional setting usually to do all the talking. When you are doing the talking, I as the instructor have to be doing a lot more processing at different cognitive levels to see where you are, what you're doing, what we can do with that information. At the same time, when you, the learners, are learning, I don't know if you're going to carry the green sheet around with you, but you might be more prone to think about feedback from your perspective and maybe even take this and work with your group of learners. And it doesn't matter who the learners are. You can use this paradigm. The thing that I would like to emphasize today is there's no one particular way that we can teach, no one method that's going to be perfect. I would love to find it if I could. But there's not one method because we're different learners, there are different levels of information, there are different levels of decision making that need to be addressed. But you did a great job. You took a small body of information that was important to me, I would hope it would be important to you, and you were able to, in 20 minutes with a small group, turn that into a learning event that no matter where you took this would be very sound. The videotaping might be difficult, but you could do without that. What I would like to do also is take a couple minutes. I put this quote up here, by the way, because it's really easy to go back to the old temptation of just read more. You know, you just tell your trainees, just read more. So I'd like you to not drop into the temptation of going back to an old way of doing things, but try and have your learners do more of the talking. And I would like to, if I could, go through a couple examples for you, just a few minutes that we have left. None of us have unlimited resources. Even when I talk with people at Stanford who there's one person doing, you know, one tiny thing, and other institutions where, you know, one of us is doing 7 of those jobs. We don't have unlimited resources, but there are some very, I think, really good resources available. I find it's hard to be able to vet those to find out which are the good resources. That would be a very good project for some of your learners, to have them look for which resources are appropriate for a particular setting. I am kind of in love with these. Someday I'm going to meet the person who built the Khan Academy. I just think he's brilliant. Wait, let me get out of this. Okay, okay. The other one, okay, here we are.
At Khan Academy, our mission is to provide a free world-class education for anyone, anywhere. And thus far, our health and medicine team has developed hundreds of videos on a variety of topics to help students learn and to expand and improve what we can offer. We're looking for outstanding content creators. If you have a deep understanding of health and medicine content, have a great intuition for how students like to learn, then we're looking for you. This might be...
I want to get to meet the heart. This is the quality of what comes out of Khan Academy. If you want an interesting story of someone who's done spectacular things in the world, read the history of how the Khan Academy came to be. Spectacular story.
I really like this picture that I found. It actually shows you really neatly
where the heart sits in our body. So you can see the heart is surrounded on both sides by ribs, right?
I won't show you the whole thing, but look at how clean the information is, how clear the story is, and how easy the graphics are to follow.
And on this side, you'd have the left lung. This is where your heart sits, between two lungs. And I'm saying left and right from the perspective of the person who owns this heart. So this is their left and right, which is the opposite of us if we're looking at it. And so the heart is actually sitting between the two lungs within this protective casing. The ribs are basically there to keep all of these important organs safe. And then below them, so if you draw this here, or if I draw it, you can see now that below all of this stuff is a really, really important muscle. So this muscle, people don't talk about this muscle, or this is not the kind of muscle that you usually see people working out at the gym, but this muscle is called the diaphragm.
Okay, I'm not going to play any more of it, but for you to see the clarity and the fine quality of this.
Are enclosing a space, right? The diaphragm becomes the floor, and the ribs are kind of the ceiling and the...
Okay, so the reason I wanted to bring that in, let's see, Shift F5, right? Control F5. Did I close PowerPoint? Okay, maybe I did. Okay. Sorry about that. I have some, and I have not vetted these to know if they are all accurate. But there are, I mean, these, I just pulled these up really quickly. These are 5 websites that I found that have medical information on them. I would urge you to find either through your professional society, through YouTube, just do a Google search, really look for who has resources, because these are done so much better than I could ever imagine we could do with the, I don't have a budget, so it would either be me or it wouldn't get done. So I would really make it a point to see what you can find, whether you choose to have a flipped classroom or not, to use media for some of those foundational structures that would benefit your learners. I would urge you to do that if you could, so that you can, in fact, build something that's more in line with how we are collecting information rather than how we used to collect information that we're trying to retrofit into how our learners are moving through the learning process at this point. And I would like to, oh, no, I'm not going to show any more. I mean, we could spend all day vetting videos. Anyhow, there is one book that I would like to cite. If you really would like to know about the best of the best in higher education teaching, this book is so well done, breaking down concepts of what makes people really, really good teachers. It's one of the best things I've seen in a long time. It goes through those concepts that I was telling you about, the bulimic learner. It also goes through levels of learners that make more sense than a lot of the traditional structures that we are accustomed to seeing in educational literature. And the study included working with hundreds of teachers who were identified through a number of categories of what made them the best in higher education. The part that I found particularly interesting about this as a resource is that the concepts that they talked about cut across age levels, disciplines. It just cuts across who can really have learners become invested in what they're learning, engage, and go into that level of deep learning instead of the surface bulimic learning that's just, we get facts dropped in. I think that has become the most important point in higher education now, that we don't have those foundation structures that you were talking about. So these facts are all coming at our learners from all different directions. We need to anchor them, and this is a way to do it. And by you using methods like the pseudo-flipped classroom that we did just now, which you were doing already before you even had the name for it, will allow then for you to work with your learners with whatever your content is to be able to help them. And if you can find any of those FD4ME modules that work for you, then you don't have to develop that content.